So I think we'll have to start with hematology, and in hematology, we are going to first give a thorough read to the topics. And the topic under consideration today will be leukemia. And first of all, we are going to study about acute leukemias. Okay. How do I fix my camera? Okay. Okay. So we are going to study about the hematological malignancies. Hematological malignancies arise when there is a process control when the process of controlling proliferation or apoptosis are corrupted in the blood cells because of the acquired mutations in the key regulatory genes. The mature differentiated cells are involved, and if mature and differentiated cells are involved, the cells will have a growth fraction and produce indolent neoplasms such as low grade lymphomas or chronic leukemias, where when the patient have an expected survival of many years. ठीक है, अगर तो chronic है and they are more mature and differentiated cells, then we can expect longer survival, and the patient and the course will be indolent. In contrast, if more primitive stem or progenitor cells are involved, the cells can have the highest growth fractions of all the neoplasms, producing rapidly progressive, life threatening illness such as acute leukemia or high grade lymphomas. Involvement of pluripotent stem cells produce the most aggressive acute leukemias. In general, hematological neoplasms are diseases of elderly, the exception being acute lymphoblastic leukemia, which predominantly affects the children, and Hodgkin's, which affect the people's age 20 to 40 years. And management of young patients with hematological malignancy is particularly challenging. Okay, now consequences of malignancy in adolescents, but we are not going to do that. We just have to do a tailored management protocol, psychological effects and late effects. जाहिर है अब लेट इफ़ेक्ट्स थेरेपी के भी आएंगे, एंड लेट इफ़ेक्ट्स जो हैं वो पेशेंट के अपनी डिजीज़ के भी आएंगे. Okay, so we are diving into leukemias. We are looking at what exactly they are. Leukemias are malignant disorders of the hematopoietic stem cell compartment, characteristically associated with increased number of white cells in the bone marrow and or peripheral blood. The course of leukemia may vary from a few days to many weeks to many years, depending on the type. Epidemiology and etiology, they include the incidence of leukemia on of all types in population is 10 by 100,000, 1 lakh per annum, for which under just half are the acute leukemias. Males are affected more frequently than females, and the ratio being about 2:3 is in acute leukemia and 2:1 in chronic lymphocytic leukemia. ठीक है, मतलब males are frequently more affected than females. Okay, geographical variation in incidence does occur, the most striking being rarity of CLL in Chinese. So CLL is very rare in Chinese, and acute leukemias occur at all ages. Acute lymphoblastic leukemia is a disease of children aged 1 to 5 years. All forms of acute myeloid leukemia. अब myeloid की अगर बात है, they have the lowest incidence in the young adult life, and there is a striking rise over the age of 50. Chronic leukemias occur mainly in the middle and old age. ये एज के साथ रिलेशन जो है we will study later too. Okay, So now we have terminology and classification. We have leukemias divided into four: acute lymphoblastic leukemia, acute myeloid, chronic lymphocytic leukemia. You have to see, ये chronic lymphocytic है, lymphocyte बन चुका है, जबकि ये acute lymphoblastic leukemia है, यहाँ पे अभी blast है. Okay, acute myeloid leukemia and chronic myeloid leukemia. Okay, in acute leukemias, there is proliferation of primitive stem cells with the limit with limited accompanying differentiation, leading to an accumulation of blasts, predominantly in the bone marrow, which cause bone marrow failure. Acute leukemia में there is proliferation of primitive cells. जो पहले के cells वहाँ पे पड़े हुए हैं, less mature cells, they will proliferate and overcrowd the bone marrow. In chronic leukemias, malignant clone is able to differentiate, resulting in an accumulation of more mature cells. Lymphocytic and lymphoblastic cells are those derived from B cells or T cells. Okay, now if we look at the WHO classification, we will see that we have acute myeloid leukemia with recurrent genetic abnormalities. AML में हमारे पास क्या क्या abnormalities आएंगी? AML with translocation 821, AML with inversion 16, APML, acute promyelocytic leukemia, which is very famous, AML with 911, AML with 6-9, AML with 3 inversion. मेगाकैरियोब्लास्टिक वाला भी कम ही आता है, इसमें सबसे ज़्यादा APML आता है, acute promyelocytic leukemia. We'll study about it further. Okay, then we have acute myeloid leukemia with myelodysplasia related changes. And then we have therapy related myeloid neoplasm, myeloid sarcoma, myeloid proliferations related to Down syndrome, acute myeloid leukemia not otherwise specified. And then we have lymphoblastic leukemia, in which we have B cell or T cell. So we will study about the myeloid classification later, because this is very important as far as MRCP is concerned. Okay, myeloid refers to the other lineages, that is precursor of red cells, granulocytes, monocytes and platelets. अब माइलॉइड लीनिएज में आपके पास कौन कौन से सेल्स आ रहे हैं? रेड सेल्स, ग्रैनुलोसाइट्स, मोनोसाइट्स एंड प्लेटलेट्स. रेड सेल्स, वाइट सेल्स, प्लेटलेट्स एक्सेप्ट फॉर लिम्फोब्लास्ट, वो यहाँ पे आएंगे. Diagnosis of leukemia is usually suspected from an abnormal blood count, often a raised white count, and a confirmed by examination of bone marrow. Confirmation हमने हमेशा bone marrow से करनी है. Diagnosis is usually suspected from abnormal blood count. This includes the morphology of abnormal cell, analysis of cell surface markers. I will tell you how is that important. Okay. How is immunophenotyping important? How are the abnormal cells important? Clone-specific chromosome abnormalities and molecular changes. These results are incorporated in the WHO classification of tumors. The features in the bone marrow not only provide an accurate diagnosis but also give valuable prognostic information, increasingly allowing therapy to be tailored. Okay, this is good.